Jessica Fowler was only 4 when she entered the child welfare system. A bright-eyed preschooler who would be separated from her sisters, bounced between homes 15 times, including ones where she says she was abused, starved, and beaten.
There's nothing I could do about my situation. It's really scary when you're in it because you don't know where you're going. I'm sorry.
But it was a group home in Ottawa where she arrived at 16, she says was the most violent.
I had to go through this just because I didn't have parents. I mean, it's not normal. Yeah, it's just not normal.
It was run by a private company called Mary Homes, which operates 5 group homes in the area. There are no foster parents here. Shift workers and youth in care come together under one roof.
There was no shoes at the entrance, as they have them locked up.
The shoes were locked up?
Mm-hmm.
Why?
So kids couldn't run.
Teens who've lived there say bedroom windows were nailed shut and food was locked away.
So this is a prison tour. This is my prison.
Inside the group home, Jessica felt trapped.
That's my room. That's the door. It's locked, so I can't leave.
Jessica lived at 2 different Mary Homes sites, where she says she was threatened, ridiculed, and repeatedly physically restrained by workers, tackled to the ground for things as simple as making toast at the wrong time.
I was just listen, I will go to my room as soon as I can get my food. And they're like, no, you'll go now. And they started trying to drag me down the stairs, pulling on my shirt, choking me. And they were kind of clawing at me to get me to force me into my room. And they went to put me in this restraint, and they pushed my face into my mattress, and I couldn't breathe at all. I was trying to scream to communicate that I was having a hard time breathing, and I couldn't say anything. Eventually they let me off, and then they took it to the floor.
So they restrained you on the bed, and then they moved you to the floor and kept restraining you?
Yeah. I never felt that before, I couldn't breathe.
Delana Land was already living at the group home when Jessica arrived. Delana got there in late 2015, an Indigenous teen nearly 2,000 kilometers from her First Nation in Northern Ontario. The first time she says she was restrained at Mary Homes was less than 2 weeks after she arrived.
I was reading a book past Lights Out, and I kept telling them that I just wanted to keep it on longer. I'm not tired. I'm being quiet. I'm reading a book. She ripped that out of my hand and said I was resisting, and then she just stepped on my back, and then it just kind of went down.
Sorry, she stepped on you?
Yes, and then I was on the floor, and then she was like, let me know when you're gonna behave. And I was probably on the floor for 20 minutes.
She kept her foot on your back for 20 minutes?
Yeah.
For reading a book?
For reading a book.
Delana says a pattern developed where workers restrained her as often as 3 times a week.
For just many ridiculous reasons, for swearing, being loud, for being disruptive, just anything, we'd get restrained.
The child welfare system operates largely in secret. There is little public transparency on how some of the most vulnerable kids are treated inside foster care and group homes. Which is why a team from Global News and APTN used the Freedom of Information Law to access and analyze more than 10,000 serious occurrence reports from the child welfare system in Ontario from a 1-year period in 2020 and 2021. The data was revealing. At some group homes and foster homes, there was an alarmingly high number of serious incidents reported, including deaths, injuries, missing kids, and restraints. And the data also suggests systemic issues at companies with multiple homes where there was a pattern of serious occurrences and restraints across many locations.
That really is a clear-cut issue of a service provider really not doing the work.
Chiara Scarabaghi is the Dean of the Faculty of Community Services at Toronto Metropolitan University.
Not every serious occurrence means that somebody's doing something wrong. However, if everybody runs away all the time, why doesn't anybody want to be here? We assume it's the kids who have a problem, when in fact those young people might be doing the right thing, running away from a harmful place.
At Mary Homes, 58% of its serious occurrence reports were for physical interventions, otherwise known as restraints. A last resort the government only permits when children pose an immediate risk to themselves or others.
Restraints are considered therapeutic interventions. In fact, I think restraints are acts of violence. Certainly the young people will tell you that they're experienced as acts of violence. And so we have an official system, like this is a publicly regulated system, in which institutional violence is considered normal and good.
No one from Mary Homes would answer our questions. But the Ministry of Children, Community and Social Services has imposed conditions on its group home licenses effective January of this year, including no longer locking up kids' shoes and providing an updated policy on restraints, outlining when they are permitted.
We have a whole group of kids who may or may not be safe.
The president of the Ontario Association of Child and Youth Care, Carolyn Yang, says the data from the Serious Occurrence Reports, or SORs, is telling.
When you have an incredibly high instance of SORs, you need to look very closely because it could be an indicator that you have incorrectly, improperly trained practitioners who are inadvertently escalating behavior.
Kura's association has been advocating for 2 decades that workers be required by law to have completed a public college or university program in child and youth care.
So in the worst case scenario today, we have, frontline workers where the minimum qualification is that they have a driver's license and perhaps a high school diploma.
This is an ad for a child and youth worker in Northern Ontario from last summer. The role? One-on-one supervision of high-risk and special needs children. The qualifications needed? A driver's license and a criminal record check. Starting in July 2023, the Ontario government will require group home workers have a diploma, degree, or certificate in a relevant field, or prior experience deemed relevant. But it falls short of requiring that training be in child and youth care. Cassandra Murphy worked at group homes run by Interface Child and Family Services from 2011 to 2014. Interface requires a diploma or degree in a social services related field. So with a diploma in corrections, Cassandra was hired.
Did anybody say to you, hey, you don't have any training in child and youth work?
Nope.
Wasn't a problem?
Nope.
Looking back, she says she didn't have the right training and now lives with regret, guilt, and sadness.
How frequently would these restraints happen?
Daily, multiple times a day with different kids.
Multiple times a day?
Yes.
You would restrain a child?
Yes. Which to me might say maybe this isn't the right environment for them.
Interface had the highest number of serious occurrence reports of any group home operator in Ontario, according to Global News' analysis. And more than half of those reports were for workers restraining kids and youth.
I think that it shows that our first response is to go hands-on with the child rather than take the time to maybe educate ourselves and to properly ensuring these kids are growing up in a normal environment.
Interface declined an on-camera interview, but said in a statement it over-reports in the interest of transparency and cares for hard-to-serve youth. It also said restraints are only used in high-risk situations where there is a physical threat. And in roughly 10% of cases, restraints involved a staff member holding onto a child's hand. The year after Cassandra left Interface, a 17-year-old boy with a developmental disability named Justin San Giuliano died after being restrained in one of its homes. In response, Interface stated publicly a goal of reducing restraint. But by 2021, the volume actually increased. Interface now says it's launched a restraint reduction plan and has updated staff training.
There was literally no need for any of it.
For Black and Indigenous youth like Delana, who are vastly overrepresented in care, the overuse of restraints is a continuation of generations of trauma.
When you think about the violence associated with physical interventions, I can think of no context in which we have made it okay to engage in this kind of violence publicly, other than the context of doing so against Black people and Indigenous people. Child welfare is implicated in Indian residential schools. It was responsible for the 60s scoop. Child welfare was built on the foundation of racism.
Among the Indigenous youth the system has failed, Amy Owen.
It did fail her.
A teen from Poplar Hill First Nation in far northwestern Ontario, Amy died by suicide inside a Mary Holmes residence in 2017. Jessica and Delana lived there at the same time.
She got restrained for talking back. She got grounded for cutting herself. It's just anything.
Delana says Amy was like her little sister, and the pair had a pact to get out of Mary Holmes.
Today is April 8th, I think, like 3 o'clock-ish. It's day 1. I'm planning the AWOL.
I was saving my bus tickets so I can take her to AWOL with me because I know she's been going through a lot.
When you say AWOL, that's a group home term for leaving.
To run away, yeah. And I kept telling her, we're going to take off. And she died on the 17th, and then I took off on the 20th. I still did it because I knew she wanted it.
Where did you go?
I lived in a stairwell in Rideau.
The mall?
Yeah.
So to you, living in a stairwell was better than living at Mary Holmes?
Yeah. At least I was able to be me. I was able to be okay.
For Jessica, who stayed at the group home after Amy's death, the anguish was overwhelming, and, she says, there was little compassion.
I didn't understand what I was going through, that I was suffering from PTSD. I didn't know that. But they would just say that it was attention seeking.
And so, in a cry in the dark, she wrote out her pain on paper.
When you're a kid, you don't know how to handle your emotions or deal with what you're going through. And the only thing you can do is kind of just run.
Much of what happens inside group homes and foster care homes is shared in whispers. The kids and teens who've experienced it, like Delana Land, know what it's truly like.
If I was bad, I'd get tossed into somewhere worse. If I was good, I'd get put into a nice home.
But the public doesn't know. Inspection reports are kept private. The reasoning? It's done for the protection of kids. But sometimes it's protecting bad operators. Chiara Scarabaghi is a professor of child and youth care in Toronto.
Right now, as we're having this conversation, there is a young person in a group home somewhere who's hungry and not allowed to get food. There are young people everywhere in the province who are moving today from one placement to another with all of their belongings jammed into garbage bags. It's a system that doesn't really focus on the dignity and the care and the well-being of young people.
Using the Freedom of Information Law, Global News and APTN obtained dozens of ministry inspection reports from group homes and foster care homes across the province. Among the inspectors' findings, homes in states of disrepair and kids who couldn't get basic medical care, nutrition, or clothing. At one group home, a youth with an impacted tooth was told to wait 6 months for treatment because of a lack of insurance. At another, kids relied on food donations from the local church for meals. Sometimes kids reported being hungry and didn't have access to the kitchen. And in one case, a child had to sleep on a blow-up mattress, soiled and smelling of urine.
It's cruel.
It's cruel, I think you've discovered, and I'm confirming for you that it is incredibly bad for many young people.
Some of the worst conditions were found in group homes.
Group homes today are seen as the placement of last resort. Young people know what that means. That means we don't know what to do with you, we can't really help you. Let's hope nothing terrible happens.
Nearly half of all group homes in Ontario are run by for-profit companies. The average cost of a group home bed is more than $300 a day per child. But for kids who require more support, like one-to-one staffing, the cost can skyrocket. In one instance, we found more than $1,200 a day.
Nobody can tell me that when that much money is involved, that the decision-making centers the well-being of the child. These things are about a commodity that is very valuable.
The oversight of how the money is spent and how kids are cared for falls to both the ministry, which licenses companies, and children's aid societies, which ultimately place kids in homes. But when one of them falls short, like Delena's children's aid worker, who was required to check on her at regular intervals, there are seemingly few consequences.
When you were at Mary Holmes, there was no Children's Aid Society worker who came to check on you to make sure that you were okay and happy in that place?
Nope.
Nobody physically came in that house?
Nope. They didn't even give me a worker here in Ottawa.
The Ontario Association for Children's Aid Societies wouldn't comment on individual cases, but says its priority is reducing the use of group care. The Ministry of Children, Community and Social Services, meanwhile, says it's reviewing the process for inspections so that it can strengthen them where necessary.
There is not enough oversight.
Kurin Yang is the president of the Ontario Association of Child and Youth Care.
Are we holding people accountable for the quality of care we're giving to these kids?
Today in Ontario, no.
For years, successive provincial governments have had a roadmap for how to fix things. Reports, blueprints, even a review of the entire system it commissioned with over 30 recommendations. Chiaris co-authored that report.
We proposed very concretely a mechanism by which one could really exercise meaningful oversight with young people participating, with families of those young people also participating, and with service providers participating. None of that has happened.
The province now says it's undertaking a multi-year child welfare redesign, including amendments to regulations which will help clarify the rules around restraints, require more detailed and extensive plans of care, and engage kids and youth in decision-making. The new rules will come into effect in just over a year.
They should just care and love us more the way they're supposed to than treat us like we're wild animals.
The group home where all 3 girls lived, run by Mary Holmes, stopped operating after Amy Owen's death, though the company continues to accept kids and youth at its other locations. Today, Delena is living independently with her 4-year-old son. She hopes to get her high school diploma in the fall so she can start studying to become a dental hygienist. As for Jessica Fowler, after she left Mary Holmes, she was placed in a foster home that finally felt safe. A home, she says, that's become family.
Do you feel happy today?
Yeah, I do.
Now, she hopes, the pain of the youth who have survived the system can teach those in positions of power how to fix it.
It breaks my heart that my bed was basically replaced with another kid who's in the same situation that I was in.
Young people have to be the drivers of change in the system. Adults have tried. We've tried for 20 years to make the system better. We fail. Give it to young people. Give the system to young people and let them drive the change. If there is one thing I would put my trust in, it's that young people will know what to do.